services, what they are doing outside their nursing profession. At least you will able to see that one. So being a nurse, try to join any kind of nursing association, and even one research society also you can join. Any, this is the things which I have joined. You can join as per your preference. And I'm going to share a link how to join this TNI or society of this thing in nursing research, or this thing society of midwife, how to join. I will share you the link. Bhuneshwar, can you share in a WhatsApp? Can you share in a chat box that links? You can go through it. Okay, it's good to join in some organization, so that so many benefits are there. I'm not going to tell you, but you can go through it. Okay, I'm talking about work experience and then conference. I have presented one presentation on a self-care among healthcare worker in the year 2021 in International Confederations of the Midwife. It was a virtual session. In the same year, I have also done e-poster presentations on International Congress of Nursing. And then talking about certifications, I am a BLS certified. I am also certified as a qualified trainer from Ajpaigo. Other than that, I have written a vlog. You can go through it. Link is here if you want to read. I have been a speaker in World Premature Day, which was organized by Sada University in Delhi. I have also written articles on self-care. So link is here. And apart from this academic and then professionals, I love traveling. You can do whatever you want to do, whatever which will make you feel happy. You can do whatever. So for me, I love traveling. So until now, I have traveled approx 20 states of India and few international trips. So this is a short, not short, it's a this thing brief CV of myself. So without much delay, now I will proceed with the presentations. And as I told you before also, I wanted to have the sessions as interactive as possible. Okay. So my today's session is bed sore. It's a very easy and it's a very common. I think everybody are familiar about this bed sore. I think many of you have so many experience, okay, related to the bed sores. I hope nobody is eating or drinking right now. So before jumping into the main session, I just wanted to give you some of the research study related to this bed sore. When I was going through few research study, research study, there was a few main points where I have listed down here. This is one of the most costly and physical debilitating complications. Though this bed sore is a very common, it's a very common, but it's a very costly. And second is like it's a third most expensive disorder. We always believe that cancer is the expensive one, or we believe that cardiovascular disease is the expensive one. But even this bed sore, bed sore related to complications or the problem related to bed sore, it's also very expensive. So it's falling under a third highest expensive disorder. It's not a small, it's not a small thing. And when they have tried to, do the survey, like every year, how many people are getting affected because of bed sore? And they found that 2.5 million patients are affecting every year. And next is like, it is the second most common claim after a wrongful death and grief that falls or emotional distress. Usually, what will happen? I tried to search articles, whether in India they have claimed any wrongful death or not. But I didn't find any kind of claim in India. But when we are talking about others foreign country, so many people used to charge for the nurses or for the doctors or even for the nursing home or for the hospital for the negligence of the care. Because everybody knows this bed sore, it will develop because of our negligence or because of, there are so many reasons, I'll explain you later. But yes, in foreign country, it has seen that they have, charge for the doctors, nurses, or even the healthcare worker for their negligence. And if they will win the case, then huge amount of money we need to pay for them. And here I have shared the link also. If you want to go in more detail, you can click this one link and you can read more. And I was going through even few of the lawyers, they are there, which has been specialized for this bedsore lawyer and all. It's like that they have designated themselves. They are entirely focusing this kind of law. So nowadays, everybody is becoming very much aware. Nowadays, I think you have also experienced this public awareness as compared to, to 10 years, 20 years back. People are not that much aware, but they are becoming so much aware about their health and about the diseases. So we have to, understand what are the consequences will happen because of this problem. So this is the one. And every 60,000 patients are dying directly because of the pressure sore. So these are the few points that I have listed down, which I feel is a little bit important. So now let's discuss about the incident. These are the few research studies. This research study try to check the incidence of pressure ulcer and its association in a different ward of hospital. This is a systematic review. Okay, what they have done here in this study, they have tried to try to analyze the 35 articles which has done on various places. In various reasons, they just wanted to try what are the incidents of pressure ulcer sore. And this 35 study, they have taken from 1997 to till 2017. And the result shows that 12% of the peoples worldwide are suffering because of this pressure ulcer, and commonly affected area are the sacrum. Okay, so and this after the sacrum is followed by buttock, heels, and then trochanter. So these are the common places. Again, I'll ask you later what are the site for the pressure sore. So as for this study, these are the common site. And when we are talking about these things, hospitals, I think you must be working in a different hospital. Here, the nurses are there who has to work in a different wards, unit and all. What do you think, as per your experience, what do you think, which are the common, wards, which are the wards where you will able to see the pressure sore the most? Can you write in your chat box, as per your experience? I might be you have worked in a general ward, medical, surgical, neuro ward. You have worked in many wards. Okay, so as per your experience, which ward you are seeing? Yes, ICU. Okay, apart from ICU, thank you. So many people are writing a intensive care unit. Yes, medical ICU. Apart from ICU, okay, thank you. ICU. Apart from ICU, okay, ICU, HDO. Okay, okay, medical ward. Okay, medical, surgical, NICU, ortho, MICU. Onco, okay, that means wherever you got posted. Okay, you got to see pressure sore. Okay, thank you for your response. So as per this study, what they are saying, the most common, as per this study, they are saying pressure sore you will mostly seen in inpatients of orthopedic surgery ward. And least you will see in nephro ward. This is as per this articles, okay, this research study. So you can, I think you have worked in different areas. So as per your experience, you can say this one. Okay, and this is the research study. If you want to go in more detail, you just click this link and you can read in more details. Okay, this is the only few points I have taken out here. Again, I have listed another second study. This study was done in Chandigarh in the year 2015. Here also they wanted to check the incident of bed sore among the admitted patient in tertiary care hospital. So what they have observed is like they have done a cohort study here, and the patients was 2,400 approx was there, and they did a study. What they did is patients were followed every alternative day. The day they got admitted in the hospital, after that what they did, every alternative day they went and they checked whether there is any sign of pressure sore, or even the patients have developed a pressure. Though they try to evaluate everything every day, okay, till the patient got discharged, or even if the patients got died. But they did a repeated assessment, and while doing the assessment they have used many scale like Cutts index they have used in order to check what is their daily living activities. Another scale they have used, a Braden scale, we will talk about later also. They have used, these are the scale in order to check the risk factors. What they found is like pool incident was approx 6 was estimated. And bed sore was maximum in intensive care unit. As you have mentioned in the chat box, so most of the, you have written ICU. Yes, even in this study say, like most of the bed sore, they are able to see in a ICU, followed by ortho, emergency, and neurosurgery. Okay. And as in previous study also, they are saying the sacrum is the commonest area. Even this study suggests that sacrum was the most common site for all the 4 stages of bed sore. Conclusion, we need to, the bed sore incidence is 6%, it's a mandate and it's an urgent need. We need to improve the quality of the patient's care in various units of the hospital, okay? For this, you need appropriate equipment, manpower should be adequate. I know like only like 1 nurses or 2 nurses are handling 20 patients. It's not possible to, give quality care, but you can use the other manpower for your care also. We will discuss later. And even administrative concerns and accountability is the need of hour. So these are the few research studies I just wanted to highlight before, touching into the main point. So this is the link here again. If you want to go in details, you can go. Now come to the bed sore main topic. Now we will discuss about the topic. So pressure sore as defined, this is the definitions as per the National Pressure Ulcer Advisory Panel. What they said is like pressure ulcer is a localized injury. Okay. And what will happen here? Skin and also sometimes the underlying tissues usually get damaged, especially those areas where there is a bony prominence. Okay, and it may be because of so many reasons, either because of the constant pressures or because of the combination with the pressures and with the shear. Okay, so this is the definition. I think most of you know, but again, it's just to refresh your mind. I'm just giving here. This is the anatomy because we are going to study the different stages of bed sore. So before that, we need to understand basic anatomy of the skin. So first one is, everybody knows, this one is epidermis, dermis, hypodermis. In epidermis layer, you will not see any blood vessels. When we are talking about dermis and hypodermis, there is a blood vessels is there. Okay. So in the stages, we will discuss which area is affected. Okay, that's why this, to understand anatomy is very important. Okay, now let's talk about the risk factors. So what do you mean? What are the risk factors as per your experience? Can you write in your chat box? Even if you want to, these things, even if you want to unmute and if you want to speak, you can speak. Write down what are the risk factors for bed sore. This is a very common topic. Okay, so that's why I'm asking you. I'm going to ask you so much. Okay, thank you. Bedridden, obesity. Thank you, Dinah. Immobility, bedridden, yes. Compression skin integrity, yes. Patients who are bedridden, yes. Bedridden, even nutrition. Thank you. Fracture, infection. Prolonged bed rest, diabetic, yes. Unconscious patients, immobility, bedridden, thank you. Fractures, neurological disorder, yes. Moisture, prolonged bedridden, yes. Thank you. Paralysis patients, okay. Thank you so much. Hydration, yes. Maybe you want to say something? Prolonged bedridden, chronic disease like diabetes and cardiovascular disease, stroke. Thank you, Gracia. Thank you so much. So many. So I think most of the things we have already covered. Okay, so I'm just going to list few. So see, here's shears, pressures, frictions, and moistures, and even ischemia. I'm going to tell you in detail. So yes, friction. Everybody are aware, and even you have mentions here in a chat box also. Friction, how it occurs? It occurs when there is a skin rub, okay? And skin rub, it's maybe either when you are doing a clothing of the patients or if you are doing a bedding. And it can make a fragile skin, especially to the people who are very much vulnerable to injury, okay? And if the skin is moist, as some of you have mentioned in the chat box, moist, yes. If the skin is moist, And if the skin is vulnerable, then little bit of the skin rub only, it will cause a damage. So this was the first risk factor. Second to shear. Shear means what will happen when the two surfaces are moving in opposite directions. Okay. For example, if you have kept the patient in elevated positions, so usually what will happen when they are sitting, and whenever they are sitting, whenever they are slipping little bit down, what will happen? Their tailbone will move downwards. And when their tailbones will move downwards, the skin gets intact over the bony prominence. And what will happen? So your tailbone is moving downwards and the skin is getting intact. So it's like opposite directions. Okay. So even if it's happening, then again, there is a chances that your skin will get damaged. Okay. Impaired sensory perceptions. Yes, many of you have mentioned there also. Especially the patients who is having a spinal cord injury and other conditions where there is a loss of sensations. If there is a patient is, they are not able to feel any kind of sensations, then they will not able to feel the pain. They will not able to feel the moist. They will not able to feel the pain, not able to feel any kind of other warning signs. For example, warmth or redness. No, they are not able to feel anything. So that's why what will happen if they are not able to feel, that means they will not complain you. And sometimes if we are overloaded with the work, we will not see also because of overload of the patient. So in that cases, there is a damage. And if it's, the more we will not able to, identify, the damage will be more. So this is the one. Impaired physical mobility also you have mentioned, especially in the spinal cord injury, or even some of you have mentioned a fracture, no? So yes, if the patient is having a fracture, they will not able to move. So this is one of the reasons. Altered level of consciousness, you have also mentioned in the chat box. Even the patient is having fecal urinary incontinence, malnutrition, dehydrations. Some of you have mentioned obesity, correct? In advances, usually what will happen, more we will become aged, our skin will become more fragile to break. So that is also one of the reasons. And chronic medical conditions like diabetes, cardiovascular disease. So these are the risk factors you have also mentioned in the chat box. Okay, I'm just repeating that one. So next, let's talk about the pressure points. So which are the area, patients will prone to develop the pressure sore? Can you write in chat box? I hope those who have switched on your video, I'm only able to see the mosquito net or someone is sealing. I hope you are listening. Okay, so can you write down in the chat box, what are the pressure point area? Okay, sacrum, heels, okay, back, buttock, all bony prominence. Good answer. Knee, ear, yes, sacrum, elbow, bony prominence, yes, buttock, sacrum, even scapulas have mentioned elbow or occiput, yes. Bony side like back of the head, elbow, knee, buttock, sacrum. Thank you. Okay, you could not feel the pretest. Try clear your browsing history. Okay, so thank you so much. Many of you have responded. Thank you. It feels like you are really listening the session. Thank you. Wow, I got many responses. Thank you. Okay, so here, okay, so this is the area you have already mentioned in the chat box. Okay, I'm just showing the pictures. Actually, when we are talking about pressure point, when patient is in sitting position also, shoulder blade, buttocks, heel, ball of the feet, I think you are able to see in the pictures. And on the back, also heel, sacrum, elbow, shoulders. And when the patient is on side, ankle. See, this is ankle, this side, knee, hip area, shoulders, and even ear. Sometimes we will miss the ear, but in ICU, I have seen many of the patients have this, this big pressure sores in ears. So these are the pressure point which you have already mentioned in the chat box also. Okay, now let's talk about pathophysiology. I hope till now you are able to understand. I think you understood the topic. Okay, now I move forward. It's like now we will discuss about pathophysiology of the pressure ulcer. When there is any external pressures, anything, okay, what will happen? And then after, there will be shearing force, or the frictions will act on the soft area, especially on top of bony prominence. Yes, many of you have mentioned in the chat box also. When the external pressure will exceed the normal capillary pressures, when we are talking about normal capillary pressure is usually 12 to 32 millimeters of mercury, okay? And when the external pressure is more than this, then again, what will happen? There will be the compression. And if this area get compressed, then there is no blood flow. And if there is no blood flow, then ultimately that area will not get oxygen. No oxygen means no food, okay? And if there is no food, even if we will sit for, in fasting for a long period of time, what will happen? We will die. Okay, so here also, if the skins, if that particular area will not get food for a longer period of time, then necrosis start, damage start. So in that way, it will causes a pressure shock. I think it's a very easy. Now let's talk about the stages of pressure zone. What are the different stages of pressure zone? Write down in the chat box. What are the different stages of pressure zone? Even if you want to speak also, you can unmute and you can talk also, okay? We'll be happy to hear from you. At least other participants will also get a chance to listen another voice. Okay, fourth stage, 4, 4, 4, 4, 4. That means I think everybody has done the pretest correct. Yes? Yes? Ma'am, please send. Okay, 4, 4, 4, yes. Okay, thank you. It means everybody has done your pretest correctly. Okay, yes, there are 4 stages, okay? So 4 stages. What will happen in first stage? Again, I'll request you to write in the chat box. In first stage, what will happen? Which part will get involved? Okay. To touch. Okay. If you are answering, then you can unmute. Otherwise, please stay mute. Okay, in first, okay, grade 1 is epidermis. You want to talk? Redness of skin, yes. Dermis will epidermis.
Please repeat the question, ma'am. Please repeat the question, ma'am.
Questions. Can you explain what do you understand by stage 1 bed sore? Superficial damage, redness of skin. Thank you. Presence of redness of skin, epidermis. Okay, first stage redness. Thank you. So many of you are, okay, skin irritations. The area looks red and feel warm to touch. Thank you so much. Yes, correct. Okay, let's first discuss with the stage 1. Non-blanchable erythema of the skin, but skin will intact. Yes. Yes, so many answers I got. Okay. Thank you so much. I don't have to explain much. You have already answered. But anyway, I'm going to, just again summarize what you have mentioned in the chat box. Yes, skin will be intact here. Okay, with a non-blanching erythema. Actually, here I have shown you pictures of how to test for blanching. Normally, can you please be on mute? Yes. Okay. So usually how you will test for blanching? So whenever we are touching the skin, okay, and after that you will see a white part. But in non-blanching, what will happen? That skin will remain white only. Okay. So if it's happened, that means there is a chances that underlying skin or tissue got damaged. So you have to be a little bit careful. Okay. So here, as you have mentioned already, skin will be intact. And discolorations of the skins, many of you have mentioned in the chat box. Skin will, when you will touch, skin will be warm, and edema or patients sometimes may complain about the pain. Okay. And this is stage 1 indicate at a risk persons, and it involves only the epidermis layer of skin. Many of you have mentioned in the chat box also, only the epidermis. Yes, you have correctly said, only the epidermis will involve here. So I think even in these pictures also, see, redness, everything is there, okay? But there is no damage in skin. Now let's talk about stage 2. Can you write about stage 2? Stage 2, yes. Epidermis and subcutaneous. Skin damage will be there. Thank you.
Blister formation.
Yes. What formation? Blister formation. Thank you, Nandana. Skin damage, blister, skin peeling. Skin peeling, thank you. Blister formations, many of you have. Okay, leaves an open wound blister. Thank you. Blister formations. Yes. Skin peeling, blister, skin damage. Yes. Yes, you can write. If I'll see any new, then I'll read blister, open sore. Yes, pain, redness. Okay. Thank you. So here, in partial, here, what will happen? Partial thickness skin loss with there with a exposed dermis. You can see in these pictures also. I think many of you have mentioned in the chat box also. Partial thickness loss of the dermis will be present, and shallow open ulcer with a red pink wound be visible. Okay. In stage 2, there is a damage of epidermis and the dermis. Okay, not the subcutaneous. Here, the epidermis and dermis will be damaged, and in this stage, the ulcer may be referred to blister or abrasions. So many of you have mentioned in the chat box the blister formation. Yes, you are correct. In this stage 2, there is a blister formation. Even you can see in the pictures also. See, only the epidermis, upper layer, and a little bit involvement of dermis is there. So this is a stage 2. When we are talking about stage 3, here ulcer is a full thickness tissue loss. Now subcutaneous tissue will involve. Okay, you will able to see the fat sometime, but you will not able to see the bone and tendon. Only you will able to see this fat area. This is subcutaneous tissue. This one is a bone till subcutaneous tissue. If you are able to see this kind of wound, then this one is stage 3 bed sore. Subcutaneous layer has relatively poor blood supply, as we have already seen. Okay, so that's why if this infection has reached till subcutaneous layer, then healing is little bit difficult. It will take time because no blood supply, no food, no oxygen. So that's why it will take time. Okay, so this is stage 3. What about stage 4? Can you write in the chat box? Or even if you want to say, you can unmute. What about stage 4? I hope Stephanie or Rosemary, you are listening. I'm only able to see the ceiling. What about the stage 4?
A large wound.
Yes.
Present.
What present?
Wound, it will become bigger
Yes.
than.
It will become bigger than stage 1, 2, 3, no?
Yeah.
Ma'am, in involvement of the bone, that is.
Yes. Thank you, Rebecca, and thank you, Dr. Palas. What will happen in stage 4?
Stage 4,
Yeah.
not to epidermis, dermis, including involvement of the bone.
Thank you so
Underlying.
much. Thank
That
you,
is
Dr.
stage
Palas.
4.
Yes. Now today my class is very easy. Everybody is answering. I'm getting either in this chat box and all. Thank you so much for participating. Yes, in a stage 4, as Dr. Palas has nicely explained, and even Rebecca has helped. So a stage 4 ulcer is it's the deepest one. Okay. So I'm just summarizing it, extending into muscle, tendon, and even a bone.
And
Jessica, yes.
redness.
Yes. Okay.
And the bone visibly you can see.
Yes. Thank you. Even Jessica have also added. So this second point I don't have to read now. Jessica have also mentioned full thickness tissue loss with the bone exposed, tendon, other muscles. Thank you so much. Here also. Now let's talk about. Now I think everybody are clear about the stages of bed sore. We will move to the complications. When we are talking about complications, what could be the complications of bed sores? Anybody wants to volunteers? Complications of bed sore. Rezila, you want to speak? Cellulitis, sepsis, thank you.
It takes
Yeah.
times to heal.
Yes, Jessica.
It'll take times to heal.
Yes, it will take time to heal. High risk for infections. Pasankit, cellulitis, cancer, and sepsis. Thank you so much. Infection, even amputations. Infections, yes. Thank you, Jessica. Sometimes bone infections, yes. Sepsis infection, yes. Joint infection, yes. All of you have already answers. Okay, so these are the complications. Whatever you have seen in the chat box, I have also listed only this much. First one is a cellulitis. Okay. I think everybody knows cellulitis means, and even the bone and joint, it will get infected because in the stage 4, we are reaching till the bone. Okay. And they have mentions about a cancer. Cancers will happen only in the cases where the wound healing is not happening. Okay. And there is a recurrent infection is there. And sepsis one is actually it's a rare one. Okay. You will not see commonly the patient is having sepsis because of bed sore. Yes, but there is a chances if you are not taking care of the pressure sore, then it can lead to sepsis, but the chances is rare. Okay. Now the preventions. So how you will prevent pressure sore? Anyone?
By changing the position of the patient frequently.
Thank you so much. Changing positions frequently.
Providing back care.
Okay.
And the dressing we have to do daily. Plus, we have to use the betadine solution.
Yes, do.
Betadine solution.
Others, I will request you to please mute. So, yes. Yes.
Every 2 hourly.
By giving a back massage.
Back massage, yes. Back massage, okay.
And ma'am, we have to the main is the dressing.
Yes, dressing is also important.
Dressing and we have to be to use especially the betadine solution, and we have to use the saline, normal saline.
Okay.
And some cases we have to use the hydrogen peroxide.
Okay. Thank you so much.
Nutrition.
Yes, nutrition. Thank you so much. Even I'm able to see so many in the chat box, providing air mattress, assessing risk factor, position changing. Thank you. So many of you are adding vitamin C in the nutrition, air mattress. Yes. Daily dressing. Okay. Thank you so much. Thank you so much. Most of my points has been already covered. Okay. Now I'll just summarize whatever you have spoken just now or whatever you have mentioned in the chat box. Okay. So position change. Everybody was saying position change. Okay. Yes, we have to change the positions frequently. And when we are talking about patients who are in wheelchair, then you need to change the position every 15 minutes. I think I have asked in a pre-test like every 30 minutes. Okay. The 30 minutes was wrong answer. Every 15 minutes you need to change. If patient is in wheelchair. Okay. Otherwise, if the patient is in bed, then you can change every 2 hours. Okay. Second is a skin inspections, daily skin inspections in order to prevent a pressure sore. Okay. It's a very important. Nutrition, healthy diet is a very important in order to prevent the skin breakdown or wound healing. It will promote help in wound healing. Adequate hydrations in order to maintain the skin integrity. Change fuel lifestyle we need to change. And quitting smoking. Why we are talking about quitting smoking? What is the relationship between the bed sore and smoking? Can anybody will write in the chat box? What is the relation between the smoking and bed sore? Kanti, you want to speak? You want to speak? Or you can mute. Okay. It will help in a delay wound healing. Thank you. Vivian has also mentioned blood circulations. It takes time to heal the wound. Yes. What will happen if the patient is a smoker? Okay, then the blood circulation, it will hamper the blood circulation. If the blood
peripheral vascular ischemia,
yes. So
can
usually
cause necrosis and aggravates infection more.
Yes, thank you,
Due
Dr.
to smoking.
Yes. Okay, thank you, Dr. Palas. So usually, I think everybody got the answers. It will delay in the circulations. If there is no blood supply proper, then wound healing and all will be delayed. So thank you, everyone. Yes, even I am able to see in the chat box, delay healing, reduce circulation. Thank you so much. And next is exercise daily, which will help in improving your circulations. Use a pressure relieving device such as air mattress, water mattress. In prevention, you have already mentioned in the chat box. Now talking about the treatment is also similar like prevention. Okay, so position change, I'm not going to repeat. Use of support surfaces, especially those areas where you think that area is vulnerable and it's very prone to develop pressure sore. That kind of area you need to support by using any kind of support devices like cushion, pad, mattresses, and all. Second is wound dressing. So, how many of you are? What are the solutions you are using while you are doing a dressing? Already I have shown you the pictures also. If you are able to catch few of the things, what are the things you are using while doing a dressing? That's all. Okay, Namita have mentioned normal saline. Yes, normal saline. Okay, many of you have mentioned normal saline. Betadine and NS. Okay, normal saline, betadine.
Betadine solution.
Betadine solution. Jessica. Okay, betadine, hydrogen peroxide.
Hydroxide and the Geronate.
Geronate, okay. Hydrogen peroxide, okay. Metronidazole. Even you are using metronidazole, this is first time for me. I have Savlon, okay.
Then Hydroxyl.
Okay. Hydrogen peroxide, ointment.
Then Hydroxyl, ma'am.
Okay. So Metrozil, I have never heard about using in a bed sores. You want to share how you are using a Metrozil and why you are using a Metrozil? Pasankit, you want to share? You want to unmute? And you want to share your experience? See, here nobody is right and wrong. I'm just asking what you are performing. Okay? And if it's new for others, then it's very good to know and learn from each other. Okay, normal saline. Okay. Thank you so much. So here, really what they are saying, whenever you are doing a home cleaning, you have to perform very gently, as everybody knows. Otherwise, we will cause a mechanical trauma to the healing tissue. Okay, and when we are talking about solutions, most preferable solution is a normal saline or a salt water. Why we are using this one? Because normal saline is isotonic first one. It's a non-irritant. It will not damage your healing process. Even if your tissue is getting healing up, okay, it will not interfere with any kind of healing process. So that's why even I saw in a chat box, many of you have mentioned a normal saline. So yes, you are doing it right. But recently when I, trying to search in a Google, why we are not using a betadine? Betadine, yes. Even when I was a student, I used to use a betadine for a wound dressing. Even I have used hydrogen peroxide. Yes, Rebecca, you want to speak?
Because betadine will cause skin irritation.
Yes, thank you so much. Yes, me also, when I was, before I used to do the dressing with this betadine, still I'm doing in some area, okay? And hydrogen peroxide, my goodness, during my student time, during ortho postings, I really like to, use a hydrogen peroxide, because after pouring hydrogen peroxide, the foam used to come. No, it's really nice experience. So even I used to prefer hydrogen peroxide. But recently, what they are saying, hydrogen peroxide, betadine, and the sodium hypochlorite and all, is not to use during a wound dressing, especially if it's because of bed sore. A reason Rebecca has correctly says, because it's causes skin irritant. Okay, and second thing is it will also interfere with your healing process. So that's why even if you are using a betadine, if you have a normal saline, please try to use a normal saline. And if it's a stage 1, no need to use even a normal saline. You can wash with a clean water. You can use a mild soap as well. If it's a stage 1 and if there is no skin breakdown. Okay, in that case, you can use this tap water also, or these things with a mild soap, you can use it. But if it's a stage 2 and if there is a skin breakdown, then try to use a normal saline instead of all this solution. Okay?
Ma'am,
Yes,
excuse
Dr.
me.
Park.
Initially, if you do
Mhm.
dressing with betadine, after that you cannot take the pus or that is
Okay.
for culture sensitivity. For this reason, during training time it was told, so initially you don't do the dressing with betadine.
Mhm.
After culture sensitivity you can do, but initially normal saline is preferred one.
Yes. Now, thank you, Dr. Pallas. I think now this 1,000 of the participant got an additional reason. Okay, before people were told not to use betadine only because of the skin irritations. Yes, and Dr. Pallas is adding. And another point is like, yes, if you want to do any culture test, before that, do not use this one. So most preferable is normal saline. Even you have mentioned in your chat box. Many of you are using a normal saline, so that means you are doing a correct practices. Okay, so keep it up. Second is a wound dressing. Okay, what they have demonstrated that it has experimentally proven that if you put the dressing, then wound healing will be faster. It will be 40% faster as compared to the area where you are keeping open. Okay, what will happen when you cover the area? Then that area will become a little bit moist, and this moist will help in healing process. It will help in healing. Plus this dressing, this will act as a barrier. The dust and all, everything will not go and enter inside your wound. Second, it will reduce or prevent a wound for the infections. It will also stimulate autolytic debridement. Okay, and if the patient is having a pain, at least you will reduce the pain, stimulate the development of granulation tissue. So that's why wound dressing is a preferable. Now coming to the treatment, others treatment, controlling incontinence. If the treatment is like worse, you can use the antibiotic. As in complications, so we have discussed, like one of the complications, it can lead to sepsis. So we don't want to reach there. So before that, if you feel like to give antibiotic, start with oral antibiotic. Sometimes the patients will, in case of stage 4 and all, I think many of you have experienced, the big bed sore, especially in the ortho, what I have seen, that half of his butt is like a wound. So in that case, patients will also feel a pain. So you can give any kind of painkiller as per your doctor advice. Healthy diet is necessary, and educating the caregiver, because in India, we know the scenario, we know the nurse-patient ratio. Okay, so we are not there with one patient for 24 hours. So at least you can teach a caregiver, because they are the one who are. Okay, so you can teach them how to give, at least teach them how to change, how to do their bed making and all. You can teach them. And surgical repair, if nothing is happening, then we can go for surgical repair. Here you can do the tissue flap. Here tissue reconstructions we will just take out the muscles and the tissues from the other area, and just we will put it there, and then stitching. And in some cases, plastic surgery is also required in order to replace the tissue, especially the 4th stage and all, where there is no chances that there is no skin growth. Something is there, and you can opt for this treatment. I hope I'm not too fast. Now, a role of the nurses in prevention and management of the bed sores. Here I have mentioned 5 main points. We will discuss each one. Treating pressure ulcer, this last point I'm not going to discuss in detail because we have already spoke about this treating pressure ulcer, but yes, these 4 points we will going to discuss. Okay, now when we are talking about conducting a skin and risk assessment, what are the points you want to add related to this point? Can you write down in chat box, or can you unmute yourself when you can speak? I hope I'm clear. Okay, can you give any points related to how you are doing the skin assessment? What are the risk factors you are checking? Anything? Check for the circulations. Okay. I check for the circulation. Check for redness, discolorations, redness. Okay.
Have to check for the blister.
Blister. Okay. Thank you. Thank you. And anyone wants to add? It will good to know from someone else. Amanda, you want? Can you please mute yourself? Those who are not speaking.
Ma'am, as associated morbidity factors, risk factors like diabetes mellitus, that is important.
Yes. Yes. Okay. Risk factor. Any comorbidity?
Risk.
Yes, we have to check. Yes. And even I saw 30 responses here. Skin dryness, sign of redness, clenching of the skin, sensory loss. So many I got. Thank you so much. It feels like you are really listening the sessions. Thank you so much. Thank you. Yes. I'm just going to summarize what you have mentioned in the chat box, okay? Oh, yes. So predisposing factor for the bed sore development, skin conditions at least twice a day. All these factors you have already listed down. I'm just going to read. Skin for increased warmth, moist, mobility, circulations. If there is any kind of neurovascular status, patient if there is any kind of incontinence, nutritional, hydration status, or any health problem, as Dr. Palas have also added. Okay, so you have to assess all those things. So what you are using, how you are assessing in your area. Anyone wants to share any experience? Are you using any tool, or how you are assessing the skin? I got 26 response, duration of stress. Okay. Anyone wants to share your experience? How you are, okay. Rosemary have mentioned, yes, bread and scale. Rosemary says, you in your facility, you all are using this bread and scale. Can you unmute yourself? Rosemary says, are you using this bread and scale in your facility?
Yes, ma'am.
You all are using?
Yes, ma'am.
Okay. Can you tell me a little bit about this bread and scale?
We have 23 total score.
Yes.
First, we have to assess the nutrition, physical activity of the patient, mobility, fracture,
yes,
friction, shear. We assess according to the patient condition, ma'am, and we keep the score. Those who are, we have severe and mild, severe, mild score. Those who are that 19, 23, it's normal. And 16, 23, 10, 12 to 17, 18 mean mild. Those who get 9 below mean both serious now.
Thank you so much, Rosemary. It was very surprise for me to know that you all are using this bread and scale, because when I was Googling, I didn't find. I have worked in different kind of hospital. I have worked in nursing homes, like in this big hospital, but I have never seen that anybody is using this Braden scale. Thank you, Rosemary. You have nicely explained. Okay, so see here, the most widely used tool is a Braden scale. Okay, I'll show you what is this look like. And another scale are also there, like Norton, Gosnell, Waterloo scales is also there. This Braden scale was the common one. You have to assess every 4 hours of the admissions. That means this is the first assessment. Other than that, as per your hospital protocol, you can assess. Some are checking 2 hourly, sometimes some of them are checking daily or every shift. Based on your assessment, you develop a care plan, and whenever you are giving a handover, also you just give a report about the patient. Okay. So yes, Rosemary have nicely explained. So I'm not going to explain in detail this one. This is the Braden scale. It looks like this one. Okay. So here what will happen? There is a major 6 area they will check. First, they will check for the sensory perception, moisture, activity, mobility, nutrition, and frictions. Here I have given the link also. Okay, so you can click this link on and then you can study in detail. But I'm just giving a brief. Rosemary has already explained. So this it look like. So it has been categorized into 4. Mild risk is like if you are getting a score 15 to 18. If you are getting that much score, then we will consider as a mild. Moderate in between 13 to 14. High 10 to 12. And if the patient's scoring is less than 9, that means patients are severe risks for developing a pressure sore. So that's in that way we have to assess. If anybody have any doubt, you can click the link. Okay, you will study in more detail. Second is managing a moistures. Use a cotton pad that wink away all the moistures. Use a topical agent. I've seen some of the comment like which is the commonest topical agent you are using. That I also don't have much idea. So anybody, if you have any idea like which are the common emollient you are using, you can write down in the chat box. Somebody has asked in a chat box. Do not massage vigorously, because I told you friction is one of the risk factor for developing a pressure sore. Clean the area following episode of passing urine and stool. Diaper is only needed if you find like, it's really necessary to put a diaper, then only use that one. And in case of family members for giving care to the patient. So this is managing the moistures. Next is optimizing hydration and nutrition. We have to check the weight loss, check regularly. See whether the patient is able to eat independently or not, or whether the adequacy of intake is there or not, because nutrition is also helping promoting, helping speedy recovery of pet sore. Nutrition's vitamin, they have mentioned about the kilocalorie, and even I have seen in some of the chat box, like vitamin C is needed. Yes, vitamin A and C, it will help in a wound healing. So that's why I think during COVID time, most of you we ate this vitamin C. So much we took vitamin C, And eternal and parental supplement you need to take and about the hydrations. Change in weight, skin turgor, check for the urine output, and even the serum sodium level. Provide additional fluid to the patients. Okay, so these are related to hydration and nutrition. So I think this one is the last. The last point is like how we can minimize, how we can prevent by minimizing a pressure here. And then frictions. I think everybody knows, everybody is practicing, Positioning changing, we are talking so much. Here, position the knee in a slight flexion for offloading the heels. If you feel like patient is developing a pressure sore in heel area, then you can offload their body weight. And when they are awake, ask for whether patient is having any kind of pain. Okay, when patients will complain about the pain, might be this is the warning sign for pet sore. Reposition patient at least every 2 hours. I don't know how you are doing. How frequently you are repositioning your patients? In your chat box, you can write. In your hospital. Okay.
Please repeat the question, ma'am.
Yes, Jessica. Okay, yes, Jessica, you are saying something?
Please repeat the question, ma'am.
How frequently you are changing the position in your hospital?
Every 2 hourly, ma'am.
Oh, you all are doing every 2 hourly?
Yes.
And doing the record also? The
Pardon, ma'am?
recording also you are doing?
Yes, ma'am. Yes.
Okay. So even in these things in exams also we have in ICU we have a master sheet. So in their positioning changing is there. Every hourly is there. Okay. So whenever we are doing the changing position, we just used to put a tick mark. Okay, in that
Yes,
master sheet. And whatever you are doing, I think everybody know recording is very important because if somebody is going to show you against negligence of care, and if you don't have this kind of record, though you are doing. But if you are not maintaining any records, then you are in danger. Okay. ICU too early, SDO too early, wards 4 early. Thank you so
Yes.
much. Okay.
Thank you, ma'am.
Yes, recording in this note. Thank you, Sophia. Thank you. So yes, recording is important. Reposition. Yeah, I already told you. Chair mount. Already told you. Void positioning in existing pressure also. Use a 30-degree sidelining positions. Provide adequate support devices. When we are talking about provide adequate support devices, what are the support devices you are using in your facility? What are the support devices you are using in your facility to prevent pressure sore? You can talk or you can write in a chat box. I can take your pillow, your mattress, pillow, yes, pillow, yeah, your mattress, pillow. Other than pillow.
Gloves, ma'am, with water.
Gloves with water, okay. Thank you. Gloves with water. Any other round pillow, flat pillow? Okay. Variety of pillow you are using.
Yeah,
Yes,
we can
Pramila?
also use I don't know about most of the hospitals, but we can also use the heel protectors, the knee protectors. Also, we can use a beige pillow.
Okay.
Yeah, we have those kind to prevent most of the bony prominence area.
Okay, so pillows you are using. Okay, any other protector you are using? Sorry? Okay, so I have saw sacrum jelly pillow, your mattress, jelly band to put in a hill area. I have not heard about this jelly band. Lindo phylum ki lindo. Can you explain what kind of this jelly band? Can you explain? This one is a cross learning. Okay, this one is a cross learning. You can share among each other. Other, can you please mute? Cushion, I have seen 20 more response. Gloves with water fill. Daphne, okay. Gloves with water fill is not recommended anymore. Miss or still allowed. Sis Tumja, you want to add any what are this one? Why this is not recommended? I will answer you from your side. You want to Daphne?
When I attended class now, long time back, I think that is not doing anymore.
Yes. Do you know any reasons why they are not doing? Any other people also can write in the chat box. What is the reasons why we are not using?
Yeah, something friction will more occur, I think.
Okay.
With that one, friction will more occur.
Okay. Okay, thank you, Tumsa sister. Friction, no? Yes. Okay, I will tell you. Any other reasons anyone wants to write in the chat box? Okay, some peacefully I have mentioned leaking may be there. Okay, thank you. Why cut out?
No.
Are not used. I will answer you first. I'm asking you all. Binita, why cut are not allowed? What do you say? As per your experience, why these donut rings and all are not recommended now? Your mattress, pillow, leaking water. Okay. Okay. So I will tell you. So this one. So in order to provide an adequate surface, we use a pillow. Most of you have mentioned a few use a pillow, and it's correct. Okay, use a special bed. Yes, either it's air mattress or water mattress or foam wedge we can use. But the pictures which I have mentioned down here, these are the devices now we are not recommending. Okay, like synthetic skin pads or cutout rings or even a donut type of devices. These kind of devices we are not use. Even water filled gloves are not recommended. Why? Because what will happen? For example, if this is donut type of rings, if you are putting a rings, okay, if it's like this ring in this hollow area, okay, that area will be relief. But what about the area that easing area is causing more compressions? Okay, so this easing area is causing more compression, so that's why they are not recommending. Okay, that main part is getting free. Okay, it's getting a relief from the pressures, but this easing area is causing a more pressure. That is the one reason. And this, when we are talking about water-filled gloves, I'll show you few study why they are not using. Okay, so when we are talking about use of water-filled gloves, it's to prevent the formation of decorative ulcer on heels. This was the study which is done by the Stevens. What he's found is like that water-fills provides a degree of pressure relief, no doubt. Okay, so that's why many of us, even now also I can see, people are using a water-filled gloves because it will give you some degree of pressure relief, but it is insufficient to prevent the occlusion. Okay, so that's why they will not demonstrate these ones. Nowadays, they are not using. Plus, another reason is like, we don't know what is the correct volume of water. Okay, might be I'm a thin one. Okay, so as per my body weight, how much water you wanted to fill inside that glove? You don't know. Okay, so that is another reason. Okay, that's why we are not using this one. Second study was also done by C. William. What they have done using a water-filled gloves for the pressure relief, they have done a small study. Here, she wanted to evaluate the pressure difference between the heel and the mattress or latex gloves, which is filled by 260 ml of water. And when she was doing a study, she used a question survey in wards and either in wards and then nursing home. What they revealed is that 79% of the ward respondent had seen or employed the practices of using water-filled latex gloves in order to relieve the pressure sore, especially in the heel area. But what they found that though many of you are using, but they consider that this method is not an effective one because it will not prevent further pressure damage. Okay, so this was the two study related to gloves filled with water. If you want to study more, I have given you the link. You can click there and you can study more. Okay, and this is the last slide. Reduce friction and searing off. Bed should be wrinkle-free. Proper sitting alignment should be there. Patient should not slide. Otherwise, again, it will become a risk factor for pressure. So do not drag or pull. And whenever you are lifting or shifting the patients, you have to do very gently. And early mobilizations. Okay, so these are the preventive measures as a nurse. So anyone wants to share any experience related to bed sore? Anyone wants to share?
Excuse me, ma'am.
Yes.
Ma'am, suppose for those ventilator patient and for bed sore patient, suppose if we use the pillow means that the leather pillow, the most effective, the leather pillow or just the normal pillow, ma'am?
Leather pillow. I have not seen people using a leather pillow in a hospital because whenever
leather plastic type, ma'am.
Jessica, yes, pardon.
Because in the hospital, ma'am, we use the leather, the leather, like the plastic type, ma'am. We use for positioning the patient, not the normal pillow that we use at home and all.
Regarding this one, Jessica, I don't have experience using a leather pillow. Because whatever pillow you are using anyway, you are using a pillow cover, right?
Yes.
But you are using a cotton clothes as a pillow cover. So I think it's better to use with a pillow cover, because imagine if we just wanted to prevent the frictions.
Yes, ma'am.
And if you are using a direct leather, so which, as per your experience, which one will cause more frictions? Leather one, no? So instead we will use a cotton case pillow cover. We will prefer to use that one.
Yes. Oh, okay, ma'am. Thank you, ma'am.
Okay, and yes, Marilyn have responded. Leather pillow is used only to prevent from getting swell. Okay, if there is this thing, some spillage, or if the patient is having sweat and all, only just to avoid that one, they are using a leather pillow. But anyway, pillows should be covered with a pillowcase. Okay, thank you. Thank you. Okay, ma'am, I've got hospital suction machine for the pressures. So the patient can. Miracles, your uncle admitted in Nazareth Hospital with a third degree pressure sore. They use the suction machine for the pressure sore on alternate days with the dressing. Can you please explain why? Miracle, I don't have any experience of using this suction machine, but somewhere I read about this suction machine using in pressure sore. They just wanted to remove the deprived paint. I think an alternate dressing is very much important, as you know. We just wanted to remove the damage or dead skin as much as possible, because we wanted to keep that area raw. Okay, the more area will become a raw and clean, if healing process will be faster. Okay, so pus collections, you have to do the dressings. If there is a pus is there, you have to clean as much as possible, do the dressing. How painful is bed sore? It depends. It depends on the stage of the bed sore. Okay, sometimes see, especially even in the stage 1, because what will happen? Nerve cells is there in our skin, upper layer, no? So even if it's involving there, patients will complain of the pain. And also, as per the different staging, the patients will have pain. Best ointment, it depends. In different hospitals are using a different kind of ointment. Okay. Can you please mute yourself? Okay. Patients came with a necrosis not because of bed sore, but other causes. Can use the hydrogen peroxide. I think, see, hydrogen peroxide we are not recommending, because it causes an irritant. It causes a skin irritant, and it will interfere with your healing process. And I think it doesn't. Can you please mute yourself? And I think it doesn't depend only related to the bed sore. In other area also, I think it's most preferable to use the normal saline. Thank you. The suction machine uses negative pressure to suction. Yes, Anthea have also mentioned, like, suction machine we are used in order to suck out the pus and the debris. Anyone wants? You are asking, you are sharing your experience in your own language, sis? Nice song. Anyone wants to share any experience? Otherwise, I think I'm not able to say any more questions. Only thank you, post-test. I hope everybody has done with the post-test and feedback. We are already, 4:23. So I think if you have done with the pre-test, post-test, and everything, that means we will close the sessions. If anyone wants to share any experience, we are happy. Otherwise, we will end the sessions. Thank you. Okay, Tenjin, please get the post-test link here only. Okay, and complete it. So I think, thank you so much. Sorry, I've been 20 minutes more. So thank you so much for actively participating in the sessions. Thank you for answering all the questions, completing your pre-test, post-test. Now we have 2 more sessions. Okay. Then on 24th, we will complete the